We divide asthma into mild, moderate and severe in terms of having an asthma attack. Some children, when they have an asthma attack, it can be very mild and they can be treated at home, but obviously some children have a severe asthma attack which need to come into hospital and sometimes even need to go into intensive care and be on life support machines.
I ended up in hospital a few years ago. I didn't have an inhaler with me and my current one had run out and I hadn't renewed it. So I had an attack in the morning. Luckily I was at home, so there was an ambulance called, but it was pretty serious.
We refer children with severe asthma, so they have lots of symptoms despite being prescribed high amounts of treatment, so high doses of inhaled steroids and other controllers. And what we do here is we go right back to the basics of asthma management and try to work out, actually, are they poorly controlled because they have genuinely severe asthma, or are there other things we can do to help improve their control without going up on treatment?
Secondary care specialist asthma clinics are really important for a certain group of children. Children whose asthma is poorly controlled or who are repeatedly admitted to hospital or have recurrent attendances to ED. I think it's really important for them to be seen here to get the diagnosis correct and for them to get a proper management plan.
We need to recognise asthma as a long-term condition, and at the moment we see it as acute events in someone's life. Therefore, coming up to A&E is almost unexpected within the asthma profile picture. And having 2 or 3 asthma admissions potentially is unexpected. However, if we were able to review the children and the severity of the condition and make sure we had the children compliant with their medication, knowledgeable in their disease, able to take their inhalers effectively, we would probably be able to stop at least 70% of the asthma admissions and probably around about 90% of the deaths.
So at the moment, care is quite inconsistent in terms of the children that we see, and in particular addressing those basics of asthma management. So getting the diagnosis right, having an asthma management plan, and making sure they're prescribed the right treatment and that they're taking it.
Asthma sufferers in London are very unlikely to need my services, if you like, but really I look after and form a part of the management of critically ill children with asthma. So children who are so sick that they need to go to an intensive care unit because they've got such bad asthma it can't be managed at a local hospital. What we provide is a service that sends an expert team out to support a non-specialist hospital looking after a critically ill child with asthma to help them stabilise the child sufficiently. It's vital that we try and improve the overall management of children with asthma to prevent those small number of children getting as sick as to need our services. And obviously with really optimal management we may well be able to reduce the number of children dying of asthma in London. Children can die of asthma. It's rare, but it does happen. I think probably more frequently than people imagine, and it's very distressing and very upsetting.
I think there's inconsistency in care at the moment, but there is a lot of good care that goes on and some very good examples of projects that have been very successful, and I think it's about sharing the good examples of care and making sure that we achieve much higher standards across the board and that we have greater consistency.
When we review the story that comes with a child who's got critical illness in the context of asthma, we do see opportunities that have maybe been missed. So it's vital that we really try and close those.
I think we need asthma champions. So that's leaders in primary care, in secondary care, in pharmacists and in schools to be passionate about asthma and drive forward the changes that we need to make. It's not complicated, it's not difficult. We just need to do the simple things well and consistently. I am optimistic. I think we have the resources, the people and the passion in order to do it.